It's important to say that LaingBuisson has been reporting on different elements of specialist care provision for many years and produces market reports covering children's services, mental health hospitals, and adults with complex needs, which looks across the spectrum of specialist care. With integration and joined up care increasingly important in service planning and care delivery, we wanted to bring together those different parts of specialist care provision to explore themes that are common across specialist care settings. So we intend the Specialist Care Conference to be relevant for those involved in children's social care provision, be it children's homes, foster care, or transition services, as well as those more focused on providing support for adults with complex needs in mental health hospitals, residential, or supported living settings. With those involved in investing in and providing specialist care, increasingly looking across traditional service lines, be it providing transition services to bridge children and adults, or providing whole pathway support from inpatient to community settings, what we wanted our agenda topics to cover were issues that are common across specialist care. So we will be bringing in high-level panelists who are able to provide expert insights into the opportunities and challenges in their own particular sectors. So what I mean by that is across the day, we will have panel discussions that are looking at the investment landscape for specialist care, hearing from those responsible for commissioning these types of services, understanding what good looks and feels like in these types of settings. There will also be sector deep dives that look at how to make integrated care for adults a reality, as well as exploring what the government's recent children's services reform plans may mean for the sector. And of course, there's also the opportunity, as always, to hear from keynote speakers about what the changing health and care landscape may mean for specialist care providers. There are a number of factors that have led to an increased focus on specialist care in recent years, but I want to flag 3 key points that I feel are critical. For one thing, demand for these type of services has just continued to grow. There has been a requirement for more support, more capacity, and this has naturally led to more interest in the sector. Secondly, it's an area that has come under increasing scrutiny as demand has pushed up public funding costs. So policymakers and commissioners are naturally looking at how that money is spent and how services are organized to make it as seamless and integrated as possible. Naturally, the role played by independent sector providers and how they integrate with the wider health and care ecosystem is a really important part of that conversation. And finally, but I think most importantly, is that we are often talking about vulnerable people with highly complex support needs. And we are asking these questions about specialist care because as a society, we want to ensure that the care provided is as high quality and appropriate to the individual as possible. Whilst we're making the final touches to the events program as we speak, I'm pleased to say that we have a range of high-profile speakers already confirmed. Joining us will be representatives from across the health and care spectrum. These cover market-leading providers, industry experts, and LaingBuisson Award winners, all able to provide their expert views across keynote speakers and panel discussions. Investment Advisors JLL will be taking a close look at the specialist care investment landscape, joined by investors, founders, and I'm pleased to say LaingBuisson Specialist Care Award winner, Achieve Together. Meanwhile, regulatory law experts Mills and Reeve will be leading a panel discussion covering quality and regulation in specialist care, with expert representatives from the Priory Group and Voyage Care's award-winning children's services team. We will also be hearing from local authority representatives responsible for planning and commissioning specialist care services, and we'll be talking to national representative organisations from children's homes and foster care providers about the government's children's services reform plans. You have to remember that the wider health and care ecosystem is very large, and specialist care is a particularly complex area of service delivery, regulation, and funding. We wanted to make sure that we had designed an agenda that will have something to say to any audience. The event functions as an excellent entry point for those wanting to get a grasp on the key issues or to refresh their knowledge in the midst of a changing landscape, be they the lenders, lawyers, and other advisory bodies that provide critical support to the sector. There will be important takeaways for providers looking at expanding their provision into new market segments or learning from existing good practice. And for those working for public sector bodies, there's an opportunity to gain insights into how providers and investors think about the sector. I think one of the things that has really been missed as a result of the pandemic was the networking that goes along with in-person events. Virtual events can be highly informative, but you can miss the chance to have one-on-one conversations and make connections that can be so useful for business development opportunities. So alongside the session, we of course have built in breaks for attendees to chat to each other and to our panelists. And we fully intend to finish up by 4:00 so that people can have a chance to join us for a drink afterwards and have an informal conversation with other attendees rather than feeling the need to rush off home.